Good morning. It is Thursday, April 18th, 2024. Welcome to the GVD TV 10 a.m. News Update, a recap of what's trending in the headlines. I'm Primus Hutchinson. Thank you for joining us. The St. Lucia National Youth Council held a Caribbean Student Leader and Youth Advocacy Conference at the Bay Gardens Hotel in the hopes of equipping young persons throughout the island with the skills and competencies necessary to fight for change. Several youth groups were represented at the workshop, which was held in collaboration with the Ministry of Youth Development and Sports and other regional stakeholders. We have the details in this report.
In a bid to increase the amount of youth advocates on island, the St. Lucia National Youth Council, in collaboration with the Ministry of Youth Development and Sports and several regional stakeholders, held a workshop at the Bay Gardens Hotel. The conference, which ran from April 12th to 15th, sought to imbue the future generation with the attributes needed for ensuring that issues affecting them are brought to the fore. As part of the activity, several guest speakers well versed in advocacy were invited to share their knowledge and experiences with the attendees. According to Public Relations Officer of the NYC, Genevieve Gonzaga, the organization felt the need to provide this training based on the number of social and other issues faced by youth on island.
This is something we want to undertake because we're trying to equip youth with the skill set that they need to not only know what is needed in the policy-making process, but to understand it, as well as to be in a position to let their voices be heard. At the end of this initiative, we're hoping that they would have gotten the skills and that they will be confident enough to use it when they have to. We know that youth have very dynamic ways of thinking, and we want to encourage that sort of thing. And we want to increase the number of advocates that we have in St. Lucia.
The training encompassed themes relating to personal development with added focus on communication skills. According to Gonzaga, the aim was to ensure that the participants not only acquired the knowledge, but had the skill set to use it.
We're going to cover themes such as women empowerment, justice, gender inequality, just basic advocacy, all issues that you can think of that youth would want to advocate against or for, that will be there. We're also aiming to, help them with their communication, because it's not just knowing it, but also being able to deal with it as well.
Reporting for the GVD TV News, I am Eldris Charles.
Resilience following the devastation caused to the individual health systems by the coronavirus of 2019. With assistance from the Caribbean Development Bank, the island hosted participants from countries within the region for a two-day capacity building and resilience workshop.
The recent pandemic exposed deficiencies within the health systems of many countries. The world began attempts at returning to normal in 2023 after the World Health Organization declared an end to COVID-19 as a public health threat. Permanent Secretary in the Ministry of Health, Wellness and Elderly Affairs, Jenny Daniel, recounts some of the areas within St. Lucia's health sector which was worst affected.
The COVID-19 pandemic affected every aspect of our lives. However, the health sector was particularly hard hit as a need for an effective response placed unprecedented demands on the infrastructure, human resources, equipment, pharmaceuticals, diagnostic services, and all other components of the health service delivery in St. Lucia. Yet, in the face of this adversity, we have continued to show resilience, unity, and unwavering determination as we proceed with our health sector reforms.
In response to the shortcomings of the health sector during that period, the government of St. Lucia embarked on various strategies focused on capacity building. One such strategy included partnering with the Inter-American Development Bank, IDB, and the European Investment Bank, IEB, through the Caribbean Development Bank, CDB, to host a two-day regional workshop. CDB's Division Chief of Projects, Ms. Therese Turner-Jones, says coming out of the COVID period, the organization sees it necessary to improve regional health.
The pandemic really just underscored some of the structural weaknesses in our health systems and the fact that while agencies like CDB and others are trying to build resilience, economic resilience, internal social resilience, financial resilience, all the good things that development institutions like to do, what we realize that the regional health is really the wealth of this region. And for St. Lucia, I would say, as we would say in the Bahamas, the health of the nation is the wealth of the nation.
Chief of Operations of the Country Development in Barbados at the Inter-American Development Bank, Mr. Jean-Eric Fienot, says the collaboration represents a commitment to the sustainable growth and development of the region.
The project that we are launching this morning is critical for the country as it focuses on strengthening resilience and supporting recovery. This project has been made possible under a $50 million loan facility established between the IDB and the CDB in November 2020 to support the response of Eastern Caribbean countries to the health, economic, and social consequences of the pandemic.
Representative for the Southern and Eastern Caribbean European Investment Bank, IEB, Ms. Christina Isley, says though their main focus for the region over the years has been on climate action, the devastation caused by the pandemic led to a change of plans.
So these were funds that were committed to climate action, and we decided to rechannel 30 million euros towards health resilience in the Caribbean to really support countries to address the COVID-19 crisis, which, as many have stated, is still ongoing. So this EIB project in St. Lucia that is totaling almost $10 million is part of that funding, and this is one of 3 projects in Eastern Caribbean that will benefit from this EIB funding that was rechanneled from climate action.
Health Minister Moses Jean-Baptiste encouraged the participants to put their best foot forward and aim for excellence at the workshop. The Health Minister went on to say that the post-COVID period has created opportunities to create new knowledge from the experiences within the region, which can be translated into solutions.
Whatever we're doing here, we must demonstrate to the IDB and to the CDB and to the EIB that we are going to create experiences, we are going to document those experiences scientifically and possibly share them with the world. And who knows, one of you may well become a world-famous author in a particular experience.
The 2-day session focused on building capacity and resilience in the health sector to respond to COVID-19 and building public health system resilience within the region. Jade Brown reporting for the Ministry of Health, Wellness and Elderly Affairs.
Health officials have expressed satisfaction with the progress made on the reconstruction of the Lazarus Wellness Center in the Mabuya Valley. The facility was decommissioned after a mysterious fire, leaving the community to access care at the Richmond facility. Health officials are looking forward to the recommissioning, which they say will bring much needed care to the constituency.
The Lazarus Wellness Center went up in flames mysteriously over 7 years ago. According to the parliamentary representative for Dennery North, Sean Edward, the absence of the health facility has created much distress for residents. As a result, the Richmond Wellness Center was left to fill the void, having to serve overwhelming numbers of clients at times. The Dennery North MP says the reinstatement of the facility will not only benefit the residents, but also the overburdened staff at the Richmond facility.
For a number of years now, we've had to rely on the Richmond Health Facility to service all of the Mabuya Valley and environs. So with the recommissioning of the Lazarus Wellness Center, I think it will ease the burden on the Richmond facility. The personnel, doctors, nurses and other healthcare providers who operate from Richmond I'm sure they too will welcome the reinstatement of the Lazarus facility.
The Dennery North MP recognizes the need to encourage healthy living, particularly in the Dennery North Basin, which has been marked as having high records of non-communicable diseases. Principal Nursing Officer Julita Frederick Cassius says the Community Nursing Unit is extremely pleased so far with the site plans presented.
When the facility does reopen, we hope to increase the medical services that we would have offered previously, so we want to increase that as well, and also the environment, the office spaces will be more convenient and comfortable, more spacious. We can see with the tour, we are very pleased to see that we have additional spaces that have been allocated to the consultation rooms, so it means that the clinicians, the staff would have a bit more comfort to operate within, and of course we know our clients as well would be very satisfied with the services once they access those services when we reopen.
The ministry's Chief Medical Officer, Dr. Sharon Belmar George, elaborated further on the additional services to be provided at the facility.
We are happy for the increased spacing, the bigger facility, which will give us the chance to increase our medical clinics, also to increase the services that we provide, such as internal medicine, and also dental services will be provided at that facility, while we continue to provide the services that were there previously. We'll also be providing pediatric care.
Permanent Secretary Jenny Daniel says the Ministry of Health, Wellness and Elderly Affairs continues on the road to the universal health care reform, while also strengthening its health systems and supporting infrastructure.
Our keywords are accessibility and affordability. The construction of this wellness center really is reflective of our strive towards making healthcare more accessible to all communities, no matter how remote, how distant they may be, to make those health services that they need a lot more accessible. So the reconstruction of this wellness center falls in line and is very much in keeping with that perspective and that goal of the Ministry of Health. Also, we of course are aware that many of the persons who access our health facilities are elderly. So again, in keeping consistently with our mandate to look after elderly, the Elderly Affairs mandate.
Health Minister Moses Jabatis says many of the other facilities on island have already begun the process of reform and refurbishment.
We are increasing access to quality healthcare and specialist services at the Ancillary Wellness Center, the Soufriere Hospital, Vieux-Fort Wellness Center, Grosile Polyclinic, and we are looking at the Castries Urban Polyclinic. So the same thing goes here for the Lazarus Wellness Center. We will be increasing services. You have heard about the new dental services which will be available, but also we are hoping that over time we can increase specialist services so that the people in the Mabuya Valley and the communities that surround the Mabuya Valley can get access to quality healthcare services.
The Lazarus Wellness Center reconstruction project is set to be well underway for a July 2024 completion.
The National Competitiveness and Productivity Council is at the forefront of the Insolvency Legislation Reform Project. This crucial piece of legislation aims to establish a robust legal framework safeguarding individuals and businesses facing economic adversity, ensuring they receive the necessary protection amidst financial challenges. The anticipated outcomes include a notable decrease in non-performing loans held by financial institutions. More in this report from Glenn Simon.
The National Competitiveness and Productivity Council, NCPC, continues its proactive approach to legislative reform, building upon the recent enactment of the Security Interest in Movable Properties Act. Currently, the Insolvency Bill, having completed its initial reading in the House of Parliament, stands as the next significant step. This bill aims to offer individuals and businesses grappling with economic challenges the opportunity to restructure their financial obligations with creditors. Sharma Mathre serves as a Deputy Director at the NCPC.
The main goal of this piece of legislation and reform project is to balance the interest between the financial institution and the borrowers.
One of the prevailing misconceptions regarding insolvency legislation is the belief that it empowers lending institutions with increased authority to pursue the assets of debtors in default. Mathren clarified that this notion is inaccurate and proceeded to outline several critical protections embedded within the legislation.
The main objective of this legislation or this reform project is to ensure that there are proper laws in place and there is an established office of the receiver or supervisor of insolvency to ensure that no one party exercises any pressure. Now, when you have insolvency legislation and an insolvency legal framework in place, what it does is that it ensures that financial institutions are able to recover the monies lent to the general public, and that has a downward impact on the cost of borrowing, or simply put, the interest rates on your mortgages, on consumer vehicle loans will be a lot less.
The legislation encompasses the establishment of the Office of the Supervisor of Insolvency, tasked with acting as a neutral arbiter to harmonize the interest of both the creditors and debtors.
They're basically responsible for administering the insolvency bill. They will be responsible for the licensing of insolvency practitioners, and one of their main functions is to basically coordinate the consumer proposal. So say if, for example, you're not able to make a specific payment on your mortgage or your loan, then you have the Office of the Supervisor or Receiver of Insolvency present to basically arbitrate or help you with the negotiation and to ensure that the bank does not exercise excessive pressure on the borrower.
The development of this legislation has seen extensive engagement from various stakeholders, with technical assistance from the International Finance Corporation (IFC). According to Mathren, this legislation is anticipated to yield favorable economic outcomes, including a reduction in non-performing loans within the financial sector. She highlighted that comparable legislation has proven successful in other jurisdictions. For the National Competitiveness and Productivity Council, Glenn Simon reporting.
We've come to the end of the GVD TV 10 a.m. news update. Join us at 2 p.m. for a sneak peek at what's coming up in the GVD TV evening news at 7 p.m.